we are in the most dangerous part of this pandemic in a way. At least the next month or two are quite dangerous. People are getting relaxed because the vaccines are out, but we don't know enough about them. There's new mutations. So we're going to learn all about that today. I'm going to introduce the two doctors. Dr. Souhail Toubia, born and raised in Lebanon. He received his medical degree from the University of Brussels, residency in family practice from University of California, Irvine in 1985. And he practiced medicine in Orange County from 1985 to 1999. Since then, he has designed and developed innovative medical devices such as spinal implants, general surgery, dental implants, and diagnostic testing for hemophilia. He is an ADC member since 1982, has served on the ADC National Board for 7 years, and is involved with social justice, equality, human rights organizations nationally and abroad. Welcome, Dr. Souhail Toubia.
Thank you.
Dr. Raed Al-Naser, born in Jordan. He is a pulmonologist in La Mesa, California, and is affiliated with Sharp Grossmont Hospital. He received his medical degree from Jordan University of Science and Technology and has been in practice 25 years. He is multilingual and speaks Arabic. Both our doctors speak Arabic. He specializes in critical care, medicine, interventional pulmonology, and pleural disease, and is experienced in asthma, pneumonia, chronic obstructive pulmonary disease, critical care medicine, and pulmonary vascular disease. Dr. Al-Naser is the president of the San Diego chapter of the National Arab American Medical Association, or NAMA. Now, we've split up the program in two ways.
Thank you, Doris.
Oh, you're welcome. Pleasure to have you here. Dr. Toubia is going to give an overview. And if there are Arabic speakers here, please let us know, because what we'd like to do is occasionally summarize, especially about cautionary behavior.
Vaccines that were in the market, like Pfizer and Moderna, did not have plenty of time to really do studies on the new variants, while the other companies like Johnson & Johnson, like the University of Oxford, like Novavax, they had the chance, since they are still in phase 3, to do additional studies, and we will talk about that during the testing. So it's always a moving target. We have to adjust as we go along. Is there ultimate knowledge about how to treat and what have you? No, but we have a lot of now, after 10, 11 months facing the disease, we have a lot of tools on our hands. So having disclosed that, what's COVID-19? Because it was started in 2019 in Wuhan, China, and went throughout the world. It was preceded by two other from the same family, the coronavirus. One is SARS, started in 2002. SARS stands for severe acute respiratory syndrome, and it lasted about 2 years. The second one started in Saudi Arabia. It's called MERS, a Middle Eastern respiratory syndrome, and that was from 2012 to 2016. I mentioned about the variants and the mutations that we've seen. The UK, the South Africa, fever, chills, cough, shortness of breath, fatigue, body ache, headache. Some lose the sense of smell and the taste, some congestion, some nausea, some diarrhea. Number 4, we're going to talk about how do we prevent or minimize the exposure to this pandemic. The most common one, you've heard them 10,000 times so far. If you haven't, we have a problem, is mainly the social distancing, mask, washing your hands, and the precaution. Number 5, we have the treatments. And I'm going to go over them very quickly, so not to bore you with the details, but if you have any questions later on, I'll be happy to disclose. Dexamethasone is one of them, which is the steroids. It's mainly utilized for hospitalized patients in severe cases when they are on oxygen. 2, the antiviral medications, and maybe you remember President Trump was given almost all of those that I'm going to list. There is, and also like remdesivir, it's given to patients are hospitalized. The disease causes some coagulation in the lungs and other parts of the body. So that's why a lot of times we put them on some heparin, which is a blood thinner, so anticoagulation. The other form of therapy is the monoclonal antibodies. To non-hospitalized patients, what we do, we give them some form of antibodies to boost their system to fight the disease. The fifth one is the convalescent plasma. That means we take plasma from patients who had the disease, and we can re-inject it to some patients who are having the disease now, again, to help them boost their immune system. A patient can give up to 2 or 3 other patients as donors. There were issues about the non-steroidal anti-inflammatory like Advil and Motrin. Not anymore. It was at the beginning. People were cautioned not to use them. We don't caution them now. Tylenol is fine. Hydroxychloroquine, unfortunately, it had a lot of hypes, and we did not find anything to really claim that it helped the coronavirus. Vitamin D, we found that it boosts your body natural defense. It does not get any harm, and it really increases by increasing your immune defense. It helps you with the disease, and you can take it through sun or through a lot of food. Vitamin C, we have not seen anything that in vitamin C that has been helping with the coronavirus. Vaccines, we have several vaccines in the market now, some from China, some from Russia, but mainly between Europe and the United States. The first 2 that we got out in the market are called the mRNA. That means it's a genetic instructions for the coronavirus spike. The coat of the virus has a spike that allows it to enter the cells in the body, and that's what causes the infection. So those mRNA are encoded in mRNA, delivered via lipid nanopeptide. So that's how. This is Moderna and Pfizer. Pfizer is a combination of 2 companies. BioNTech is from Germany, which came up with the first with this technology. It's an old technology, but never been used before. So is Moderna, uses the mRNA. Those are the only 2 that we have in the market now available. So anyone who is getting the vaccines is getting either one. The second group is the non-replicating viral vectors. Those use a virus, like when you take the flu, you receive either mutated virus or dead virus or pieces of the virus. You never receive the live really virus. So those 2 coming up are Johnson & Johnson and the AstraZeneca. They use some form of virus to give you that, to trigger the immunity in your body to really fight the disease. And then the last one is the Novavax. It's used a protein-based. So those are the 5 actually that we will have available in the market. Johnson & Johnson is now going to be approved in the next week or 2, and hopefully by March they will be available in the market for people to take. The AstraZeneca, they had some issues at the beginning, and now it caused them some delays, but they'll be coming out soon. Testing, we have 2 types of testing. One is the PCR, which is the polymerase chain reaction, the most accurate one. And then we have the antigen test. The antigen test is not as accurate as the PCR. So if you are negative on the antigen test and have some symptoms, you have to do the PCR. What are the effectiveness of those vaccines? So far, Pfizer and Moderna are about 95% effective against the coronavirus. As I mentioned earlier, they did not have the chance to do a lot of their studies on the mutant or the variants of the coronavirus that is happening now. So they are talking about maybe adding a booster. After you take your second shot, you take a booster for those 2. The other one is Johnson & Johnson is about 85% effective, but they have the chance to work on the variants and to have some coverage to that. The Novavax is about 89% effective, and the AstraZeneca is in the mid 80s to upper 80s. As you know, some of the advantages of the Johnson & Johnson is one dose. The AstraZeneca, I believe, is 2 doses, but they don't have to be kept. And please, Dr. Al-Naser, correct me if I'm wrong on that. The Pfizer and the Moderna, they are 2 doses. Pfizer is 3 weeks apart, Moderna 4 weeks apart. They have to be held in a temperature below 70 degrees or below 50 degrees, which is kind of a problem. And it's 2 doses, which makes the Johnson & Johnson, of course, is a better alternative, because it can't be kept in the fridge and only 1 dose. So those are the advantages and disadvantages. Few statistics. So far in the US, we've delivered about 50 million doses of vaccines. And so far we have injected about 29 million people have received the vaccine. Also, worldwide, we have 102 million infected with the coronavirus, and 2.2 million have died worldwide. That makes it about 2% death rate from the disease. In the US, we have 26 million people infected, 440 million people died from it. That puts us at 1.6% of death rate from the vaccine. If you want to compare that to the regular flu that we have normally, it is higher than the regular flu, but considering that it's 1.6, it's not that bad to really mention it. But it is definitely caused a lot of death, and we don't anticipate improvement from this death rate until another 2 or 3 months, until we reach herd immunity. And probably Dr. Al-Naser will talk about the herd immunity. Side effects of the vaccines that we have available now, it's mainly within the first 7 days from the injection. There are mainly fever, chills, tiredness, headache, and some anaphylactic reaction, which is very, very uncommon, but it happens sometimes. That's why when you receive the injection, they keep you for about 15 minutes to make sure you're not having this kind of reactions. So with that, I covered an overview, and I hope I did not take a lot of time from Dr. Al-Naser. So to give you this overview, information about where we stand now from disease point of view, the pandemic, and from vaccinations, and what we have as tools on our hand. Needless to say, the most important thing, if you can get the vaccination, and some people are wondering if they need to take the vaccination or not, yes, take it. Even if it is 50 or 60% efficacy in it, it's better than 0%. Safety, yes, we admit that we did not take years and years to evaluate the safety, but you have to remember mRNA is not a live virus. None of that is live virus. It should be quite safe. We're all taking it. I took mine. I took the first dose. I'm waiting to take the second one, and a lot of people are doing so. So I encourage everybody to do that, but more importantly, continue wearing the mask, continue social distancing, and with that, I'm done. Thank you.
There's a lot of information that you just covered, and then this is not very, easy to put it within 5 or 10 minutes that you did. And really, you did an amazing job. And I would like you also to, during the discussion here, maybe the next 45 minutes, maybe if you have anything to add or any comments, please feel free to step up, and don't be shy. Your role did not end yet. Okay.
I'll be happy. Thank you.
One other thing, it's for Doris. I would like to thank you, Doris, before you start the questions, for all your support that you're doing for the Arab American community, and in San Diego and Southern California, and across the United States. So Doris was a staunch supporter of our effort at NAMA to raise attention that COVID-19 impacted the Arab American community here in San Diego, disproportionately, like other ethnic minorities across the country. So Doris was very, very strong supporter of our efforts to establish the petition with San Diego County to add ethnic identifier for Arab Americans. We were there every single meeting with the candidates, mayoral, congressmen. She raised this issue along with Ojini, who's with us today.
Can I get the virus more than once? And by the way, over 95,000 people have died in the United States just this month.
Theoretically, yes, and there are reports that some people got the virus more than once. Okay, so let's put it this way: the immunity that we acquire from infection of the virus probably would fade within a few months after the initial infection. That's number one. Okay, so we estimate that the protection could not be that long from the infection. Number two, it depends also on the severity of the infection. Okay, there are reports that people who have mild illness did not mount enough or strong and long-lasting protection, where the people who had more severe infection had mounted more immune response. Third, also now we having the concern about the new mutants or the strains, and there is a possibility, there are some reports that indicate that there could be a possibility of reinfection with a new mutant or a new strain. An example of this that we had witnessed in Manaus, Brazil, where it was really there was strong, widespread infection back in April, and the health authorities could estimate that maybe 70% of the people got infected with the virus in that region. But now there is a rise again of the rate of infection, which is probably due to the new mutant or new strain. So yes, there is a possibility that we can get infection with the virus more than once.
A related question that just came in that isn't on my list is from Dr. Hassaniya. If you get COVID-19 after the first shot, how long do you wait to get the second shot of the vaccine? That's an obscure question, but maybe it's a quick answer, I hope.
Okay, so again, let's go back to the first, to make it simple. Okay, theoretically, yes, you can get COVID after you're getting the first shot or within days of getting the first shot, or even like up to maybe 3 weeks or 4 weeks. Both the Pfizer and the Moderna vaccine, as good their efficacy is, this efficacy was measured after 2 weeks or so of the second shot. So there's a theoretical, or there is possibility that you might get, the disease itself within, a few days or even a few weeks of the first vaccine, especially if you are a high-risk person. And, like we have seen this in people who work in the healthcare, they got the vaccine first dose, and then they found out themselves they got COVID itself. So now the recommendation is at that time is to probably wait a few weeks to get the booster shot. And I don't think that there is a clear recommendation at this time, but I would think the CDC would recommend to wait a few weeks until you get the booster shot.
Okay, should I wear a mask and practice social distancing if I do not have symptoms? That's a very, yeah, yes, right?
Absolutely, absolutely. Everyone should practice precautionary measures and social distancing. If you are healthy, you don't want to get sick. If you have the disease itself, you don't want to spread it to others. So, and it works for both ways. If I have symptoms, of course, if you have the disease and you have symptoms, you should be quarantining rather than going out and spreading the disease. Well, if you don't have symptoms and it's protection for you as well as protection for others. Now, there is about 40% of people who have COVID-19, maybe they're asymptomatic or pre-symptomatic. So you really don't know if you have it or not at that time. So that's why it's important to wear your mask, protect yourself, protect others, and so on.
Because it's a common thing that people are doing now. They got COVID, they spend a week or 2 or 3, depending from one to the other. And then after a week, they are asymptomatic. They are feeling much better, but still their test is positive. And they feel compelled because they don't have any symptoms that they can wear a mask and go in public. Absolutely not. Until they are totally clear, still they go in public with a mask. So we need to be careful about, even if you are asymptomatic, and Dr. Al-Naser mentioned that you have 30 to 40% of people who are totally asymptomatic, they have the disease and they can't transmit it. Those are the worst one because you don't know they have it and they are transmitting that. So be careful about it.
Vaccine, I went through my 2 doses.
Yes,
and
okay.
I still transmit the virus.
Well, that's a very, very good question. Yeah, for now, there is not much public data about this question in particular. We think that yes, you might still get the infection, but it might not affect you, and because the vaccine protects you from getting the disease. But you might still be a carrier of the virus in your upper airways, in your nose, in your mouth, and so on. And you could potentially spread the disease to others that they have not got exposed and they haven't got the vaccine. So for now, the recommendation of CDC and other health agencies is to continue wearing your mask and practice your social distancing and don't let your guard down yet. Okay, there's still too soon until we achieve that level of herd immunity where 75% of people already vaccinated or quite immune, and then we will not be able to let this time. So we should be still using our precautionary measure. يعني بالعربي this is very important question. يعني في ناس كتير بيعتقدوا انه ما اذا اخذ اللقاح خلاص انتهى الامور وممكن ما يلبس الماسكات او القناعات. لا، هذا الحكي مش صحيح. لحتى نوصل الى مرحله من المناعه المجتمعيه الكامله هذا الشيء يعني سلوك خطر جدا، بحيث انه يعني ممكن انه يؤدي الى سرعه او الى انتشار المرض بشكل كبير.
How is herd immunity achieved? When do you think we can expect that to happen? Is there a timeline for that or some kind of prediction about that?
Herd immunity is, in general, achieved when probably 70 or 75% of the population are immune. And we're talking about immune mostly by vaccine, and also could be, there are also some natural immunity from the infection of the people who got the disease. So until we achieve that, it is still, the disease could potentially spread for a very, very long time. And of course, this is where the importance of getting people vaccinated as soon as possible. Because if we don't achieve that goal within a time frame, the disease will continue to spread. And then we're also taking the risk of having different mutant strains that might be resistant to the vaccines and the therapy that we have. So this is very important, and it is not an easy thing. This takes, government, states, and the whole, efforts of WHO and so on to reach that point. How we can get vaccine to so many people, or pretty much everyone that need to be vaccinated, and as soon as possible. And this is a very, very big question. This is not easy to answer. So many logistic things, so many barriers, so many hiccups, in the distribution of vaccine and so on. So, but again, we need to reach that. The principle, is to reach that herd immunity as soon as possible. Yeah. Go ahead.
Doris, if I may add, so far, as you can tell, I like numbers and statistics. So far, we're giving about 1.2 million vaccines per day so far, as of today. So imagine to reach our country is 340 million. So to reach 75% of that, you're talking about 225 million. We're far off from that. We have 26 million infected already, so they get the immunity. For how long, we don't know. We already injected 29 million, call it 30 million, so that's about 55 million people have received the vaccine and get infected naturally. So we need to get to at least 270 million people. So we still need about 215 million people. At a rate of 1.2 million per day, it's going to take us another maybe 200 days. So that's way too long. So we need to up it to 2 or 3 or 4 million doses injected per day. And then the question asks, when can we reach that? So you do the math. If we can give 4 million doses per day, we can reach it sometimes during the summer season. Otherwise, it's going to be until next year. So hopefully, now the new administration got more vaccines on hand to be able to give it to people. And then hopefully the states are more organized to give it as many, because we have 20 to 25 million vaccines in the states that they are not given to patients, which is a big delay and waste.
The trials in the vaccines that are already approved now here in the United States under the emergency authorization, particularly Pfizer and Moderna, were studied on different groups of population. In particular, the distribution was pretty much even, male and female, both Pfizer and Moderna. There are different age groups and young, middle age, and older. Probably you're talking about people in the late 60s, not many people maybe above 70s though in both trials. Now there are also what we call it the ethnic distribution that is very important here in these trials. And both Pfizer and Moderna were reasonable in terms of involving minorities, African Americans, Latinos, other minorities in particular with their trials. So they have some good data about that it kind of matches or what is in real life. And also these patients might, or the people in the trial were also pre-existing conditions, the common pre-existing conditions like diabetes, hypertension, obesity, chronic lung disease, and others. While though there were no people in the trials who are pregnant, in particular women who are pregnant, they were excluded from the trials. And also people who have immune-related disorder or immune deficiency. So they were not in these trials. And also for Pfizer and Moderna, Pfizer maybe didn't test children below 16. Moderna didn't test children below 18. So to summarize it, yes, these trials are already have good representation of how the population are with a few caveats. Now, to your point about what's going on in the Palestinian in Palestine, but we know that there is a problem there. Okay, and it has two facets there. One is that the spread of the disease in the West Bank and Gaza is actually, very significant, but they don't have access to enough vaccine at this time. And it's tragic that we see Israel is the number one in the world right now in terms of vaccine distribution. And actually, they almost vaccinated over than 30% of the population there, while their neighbor, who are actually they are responsible for as an occupying force under Geneva Convention, they're not even putting any effort to spread or get the vaccine to the Palestinians in the West Bank and Gaza. So that's quite a bit of a political question, and maybe I'm not the best person to answer it, but I'm sure as an Arab citizen, and I'm very concerned about that, and we should advocate for our people in Palestine to get the vaccine that they need, because they're really heavily impacted there, and it's a tragic situation, and we would like to see ADC and other grassroots organization in the United States push this new administration to put pressure on Israel to take a responsibility for this as an occupying force.
Thank you. Would you like to add to that, Dr. Toubia?
Yes, one fact is it's a reality thing. 16% of the population of this earth is monopolizing, and I don't want to use the term monopolizing in a negative way. So 16% of the population of this earth got 6% of the vaccines. They paid for it in advance because they had the financial capabilities. So that leaves 84% of Earth has only the remaining 40%. Now, what country has the money is able to vaccinate, and as you know, Israel receives a lot of financial aid from the U.S., and they were able to purchase, along with the U.S., a lot of the vaccine. That's why out of 10 million already being vaccinated. So it's a tragedy. It's a serious tragedy that the Palestinians are left out in the cold. Not only they are being occupied, they are being deprived from basic protection against the pandemic, and it's sad and tragic.
All right, thank you so much. It is sad. I think what's key is the Geneva Conventions. They are violating the Geneva Conventions, as they have with everything else. So, yeah, we have to do something about it. So I'm going to ask two questions now and add Eugénie's and a few others. What are the treatments to ask for at the hospital, or others can ask on your behalf if you end up there? Now, Dr. Toubia gave us a bunch of drugs that were used. And then also Eugénie asked, what is the reasoning behind lying patients prone when they are in severe respiratory distress, and how effective is it? So if you're in the hospital, whether you have someone speaking for you or you're well enough to speak for yourself, what should you be advocating for yourself?
Okay, thank you. Let's go a little bit, make it simple, what we have, treatments for patients who get admitted to the hospital. Number one, that patients need to be admitted for the hospital is oxygen. So this is where, when it gets to that point that your breathing is compromised, your oxygen level is low, and you start to get into a stage where it might be life-threatening. And that could lead to a sequence of events and different organ and system failure. So that's why people who have disease, that it's mild and, they're not very short of breath and their oxygen level is good, they can be at home, quarantined, isolated with just simple supportive therapy, and that will be okay. And hopefully they will recover with time. Now, for people who need the hospital, again, that's oxygen is the main thing. Second is there are treatments that are indicated or warranted now for people who are sick to be in the hospital, which is mainly the dexamethasone or the corticosteroids. So that's number one for mild, moderate, and even severe cases. So and that's based on a study that was done in the United Kingdom and showed that actually steroids help improve survival and cut down the mortality on patients who needed supplemental oxygen. And it doesn't help for the people at home who do not need oxygen. So actually, it's more detrimental. So if you are doing fine at home, you don't need oxygen, don't take steroids, because actually that makes things worse. And so it is not indicated for those patients. So that's, I want to make sure that this is a very common question I got from my patients in the office. Oh, should I take steroid at home? I said, no, it is actually could be worse. The second thing that's now it's indicated for patient for mild disease required hospitalization is the antiviral agent remdesivir, and that's shown that's improves or shortens the duration of illness by maybe 4 days compared to the placebo. So that's in general that's one other thing that might be used in this certain patients who need hospitalization, need oxygen. They are usually defined as mild to moderate disease. Not needing ventilator, not needing those machines, we call it high flow or non-invasive ventilation. So that actually now the guideline is do not use remdesivir because it's really does not help for the people who have very severe disease. Other supportive therapy is anticoagulation, as I think Dr. Souhail mentioned that in the introduction, which is a blood thinner to prevent the formation of clots that might be these patients are predisposed to because of the virus. And the general supportive care in the hospital, adequate hydration, nutrition, prevention of clots, prevention of infection, and so on. Now, one important thing is for, I think Eugenie mentioned in her question, is how that part of the flipping patients on their stomach, or we call it prone position, help the patient with their oxygenation. Yes, there are some people might benefit from this technique, and sometimes a little bit of improvement, a few points here and there, a percentage could mean life and death. So the principle of how the prone position improve oxygenation is when you sleep on your stomach, you open parts of your lungs that's kind of squished. Okay, so there's a little bit better chance that those part of your lungs get air from outside and push the carbon dioxide outside. We call it ventilation. So that's the principle. It has been, it is not new. This has been, well studied in the critical care for many years now, and we use it on the patients who are on the ventilator. And when even with the high oxygen and the high pressure from the ventilator, they're still not getting enough oxygen in their body. We use that technique to improve the oxygen. But now with COVID-19, because we have seen so many patients, we start to use this technique even on the patients that are awake. They are not intubated and not on a machine. We encourage them as much as they can to stay on their stomach or to sleep on their stomach, and so that will improve the oxygen level. Sometimes, again, a few percentage, 2, 3, 4% of change or improvement might make a difference and prevent further intervention like intubation and a more aggressive procedures.
Okay, thank you. Part of the reason I asked that question, of course, a patient in the hospital is not going to necessarily probably not be able to ask. I think people might feel a little paranoid that the privileged get the best treatments, like when Donald Trump was perhaps in the hospital, they tried everything, and that normal people do not. So I think that maybe that question is from that anxiety of being treated fairly, regardless of whether you're rich or poor or who you are. But that's another question. Maybe you can address it in some other way. There's bear with me because there's a bunch of questions in the chat and I want to combine them with some of the questions that I have set out here.
Doris,
Yes.
Can I add
Yes.
something?
Absolutely.
To give a piece of information that is recommended if patients have COVID and they are at home, to get oximeter. This is a device that will measure your oxygenation. And to support what Dr. Al-Naser said, few percentage, 2 to 3% of improvement of the oxygenation. So to give you an idea, normally our oxygen saturation is over 95% and above normal healthy people. So if it drops below 95, you start watching it carefully. If you drop below 90, 88, 89, you're already compromised. So that's why when he's saying that 2-3% could get you from 89 to 92, at 92 you're more comfortable, but it's that few percentage makes the whole difference. Unfortunately, the situation, and also to answer what should be asked at the hospital, the clinical situation determines what the physician seeing the patient, what to use the monoclonal or for outpatient use the dexamethasone, the anticoagulation, those depending on the severity of the patient's situation. And we can't, unfortunately, give an advice what to go and say, hey, I want to be on dexamethasone. Luckily, we live in competence, and hopefully your physicians in the ER or in the on the floor would be amenable to give you what's best for you.
Okay, thank you so much. I think that answered Donna Baranski Walker's question. She also suggests, I'm wondering if we should make these more available in Gaza. That's a whole other, again, that's part of the political aspect of this, and I will make a note of it and perhaps in a summary, figure out if we could answer that question a little better. It's very hard to get any kind of medical supplies into Gaza, especially. I think also in the West Bank, but even harder in Gaza. What are the treatments for home remedy? And I heard, and this might be completely nonsense, is you take cloves, you know, the cloves that you very scented, and you crush them and you have them like a spoonful of honey goes down right away, and that should help with congestion. Now, the other related question regarding congestion is the symptoms that you get after your second dose could be very tiring, but I believe they don't involve congestion, because that would be almost like, well, then you have the disease, you know, then you better go to the hospital or something. So I just I wondered if there were other home remedies.
Okay, thank you. Well, the most important thing that you do if you get the disease and you're at home is first is that you quarantine yourself. Okay? Try to stay, if you can, in a separate room and distance yourself from the rest of your family, if you have the means to do so. Okay, if you have an adequate, rooms in your house, and basically, you want to try to quarantine yourself in that location. Get your food, or ask your family to bring you food, your washing cloths, soap, water, etc. So, and again, the recommendation now changed about the quarantine times. Initially, it was 14 days. It was cut to 10 days. Now maybe it's 7 days, because there are so many cases. Now, most important thing, if you get the disease, the virus, is to get rest and hydrate. Okay, drink plenty of fluids, water, drinks, soups, whatever it takes to get you hydrated. So that's number one. Number two is vitamins may help, but personally, there's not much strong evidence that this way or that way. But I always tell my patient they don't harm. Take vitamin D, vitamin C, zinc. There are some studies says that the immune system gets stronger, but there is not enough evidence to say yes, this is going to be curative, but at least, they are not harmful. So I'm okay with that. If you have a temperature, you take paracetamol, Tylenol, to help with this temperature and rest. Now, the most important thing is for home is to watch for worsening symptoms or worsening condition. And that's where we recommend to keep an eye. You start having trouble of breathing, or you're having chest pressure or tightness, or you started not able to concentrate well, or there's some confusion, or an inability to stay awake, or difficult to wake up, or if your lips or face start to turn purple or blue. So these are really warning signs, and that means that your oxygen level is started to come down, and you're having the virus in your lungs, and that's basically you're having pneumonia. And in these cases, that's why the pulse oximetry is a good tool also for monitoring. If you have the means to purchase a pulse oximeter, even that cheap $20, $25 pulse oximeter is still a helpful tool that you have at home. And as Dr. Souhail mentioned, if your oxygen levels start to go down below 94%, and you're a healthy person, you probably need to watch. And if it's below 90%, that usually means that you're in serious, or at least in a situation that you probably need to talk to your doctors and maybe go to the hospital and so on. So home remedies are basically supportive therapy at this point. Hydration, get rest, maybe vitamins, not herbal, and healthy nutrition. So there's no other, at this time, treatment that would cause, would be beneficial. Now, one thing is for people who have certain conditions or comorbid conditions that might put them at risk for severe disease, severe COVID-19 disease and death. They might want to check with their doctors about monoclonal antibodies. And so this monoclonal antibodies are now under emergency authorization for patients of certain age and of 65 or who are above 55, but they have different comorbid conditions like obesity, high blood pressure, diabetes, chronic lung disease, immune system disorder. So you want to check with your primary doctor if you have any of these conditions and if you're a candidate for monoclonal antibody. That's people who are not needing oxygen too, so are not needing hospitalization, because you cannot get that in the hospital. It's an outpatient treatment. And this is the treatment that you mentioned, Doris, about one of the treatments that ex-President Trump got, which is the monoclonal antibody, one of the treatments that he received at that time.
One of my friends told me today that she had COVID-19 the end of the year, and she was hospitalized. And she told me that she had experienced a certain level of memory loss. She said, like, her clients, she cannot remember some of her clients.
We're talking about what we call it post-COVID syndrome, or the chronic COVID. And these issues of mental problems, memory problems, people who have delirium that happens in the hospital, or could have long-term complications on the brain, especially elderly people. They might have significant deterioration of neurocognitive function, and so it is there. It's reported. Now, how often that happens, I don't have good statistics about this right now, but in a clinical practice, yes, I'm seeing cases like this. We have patients who recovered and they still have issues with memory, still have significant anxiety and depression, Patients tell me that they're having nightmares right now, and, experiencing nightmares and so on. So that issue of long-term complication of COVID is there, and we're going to have more information as we go through for the people who survive. So that's why we were talking about taking the disease seriously, because it's not just you get recover and you'll be back normal. So there are people who have long-term effects, and that's why we need to emphasize that point.
Thank you. We have gone well over an hour here. I'll try to condense this into an hour-long video afterwards. But I wondered if you wanted to make some closing remarks, perhaps Dr. Toubia first.
Again, not to repeat, social distancing, keep wearing masks even after vaccination, even after when you get the disease and recovered, and take the vaccination as soon as you can. I don't want to say ignore potential side effects from the vaccine, but if you catch the disease, what Dr. Al-Naser was saying, that the post-COVID, also we call them long haulers, where they have some complication of lung problem for a long time, memory loss, depression, you name it. So keep all those precautions, the vaccine as soon as leading healthy life, and try not to expose yourself much at all until hopefully by the summer we reach herd immunity.
Thank you. So I just wanted to say something. I mean, I've been in practice with pulmonary critical care over 25 years right now. I've been through certain diseases that they took heavy impact on people. When I started training, HIV/AIDS was a life-threatening disorder or disease, infectious disease that taking many people's life. But that was it's still limited to certain group of people with certain behaviors, or they had exposure to blood products. And then we also, every year, we go through tough influenza season every now and then, and the most famous one was the swine flu in 2009 and 2010. But this is but nothing like what we see right now with COVID-19. This is a different caliber disease, affected the people across the globe. Every single person in this world was affected. If affected by getting the disease, getting some family got the disease, or just by the economic or social impact of the disease. People lost their jobs, lost their lives, so much mental stress, psychological stress. So it affected everyone in this globe. So there's no way to end this and go back to what we used to live, no matter where you are in any part of this world, without having an end to this spread of the disease. And I don't see any way out at this point without massive vaccination that will get us into that point. So basically, I am talking from as a frontline healthcare worker. I see the sickest of the sick people, not only just simple disease. I see people who are dying in the hospital, and people who get into the intensive care unit on a ventilator. They have really limited chances of surviving. So we want to get this over this, and hopefully everybody will be safe, everybody will go back to normal life, and so on. So and thank you, Doris, for allowing me to be on your platform again. And again, I'd like to thank you again for your support of our effort at NAMA, and being an advocate for Arab American health equity. Thank you.
Thank you so much, both of you. And hopefully we can get through this, and that these, we got to be vigilant, right? We got to wear masks, double masks. Don't be shy, especially inside, or you're going to get it, or you might not get it, but you'll spread it to someone else, whether you had a vaccine or not. So I think that kind of vigilance is super important.
Thank you very much, Doris.
Thank you.
Thank you, Dr. Al-Naser. Thank you, everyone.
Thank you.